Okay, so we're going to be working on our airway management skill. In this skill, we will begin by coming up to our patient. I'm going to, of course, have my BSI or PPE. I'm going to assess my patient for a gag reflex.
Okay,
Does not appear to have a gag reflex.
There's no gag reflex.
Okay, I'm going to measure my OPA, make sure I have the right size. Insert it, making sure it's resting at the teeth. And my patient begins to gag. And I'm going to remove that OPA. I'm going to consider turning the patient onto the left lateral recumbent position while I grab my suction tubing and catheter. I'm going to connect this to my vacuum. I'm going to make sure that it's going to my patient. And then the other side is going to be going to my rigid catheter or yonker. Okay, I'm going to test it, make sure that it works. This does not need to be covered, so it should be functioning. I'm going to go into my patient's mouth, only as far as I can see, suction on my way out until the oral pharynx is clear.
Okay, and it is clear. And like Miriam said, guys, we can't do it with this patient because, you know, it'd be hard to turn him on his side, but while you're suctioning, that patient is going to be on their side. They're not going to be vomiting while in the supine position.
I'm now measuring for an MPA, making sure that it's going from the tip of the nose to the earlobe, and I'm going to insert double toward the septum. MPAs do come with lubrication, so do go ahead and use that if you have that available. Okay, that's inserted. I'm going to begin ventilating my patient. I'm gonna use just enough air to make sure that I'm getting chest rise, and doing my C technique, making sure that I'm giving air every 5 to 6 seconds. I normally just go with 5.